Welcome to the Lippincott Medical Surgical Nursing video series. Today's topic, caring for a patient who is experiencing complications from chemotherapy. In this module, you'll learn what's involved in caring for this patient and how to deal with common patient questions and concerns. We'll begin with the report you'll receive from the previous nurse on duty. The report you'll hear today is given in the SBAR method: situation, background, assessment, and recommendations. Let's see it in action.
Okay, so let me give you a report on our patient.
Okay, sounds great.
Okay, so Jessica Stone is a 35-year-old female with no known drug allergies. She's a patient of Dr. Edelman and was admitted last night with dehydration.
All right.
So 8 weeks ago, Jessica had a mastectomy on her right breast, where they also did breast reconstruction. The incisions healed, and she was started on an outpatient chemotherapy regimen of cyclophosphamide, methotrexate, and fluorouracil. The first dose of chemotherapy was started 2 days ago. She came to the ER last night by her physician's request, since she's been experiencing continuous nausea and vomiting since the chemotherapy started. Her vital signs in the ER were temperature 99.4, blood pressure 90/50, heart rate 94, respiratory rate 20, and oxygen saturation 97% on room air. Also, a CBC, Chem7, magnesium, and prealbumin levels were performed.
What kind of treatments was she given?
Well, an IV was started in the left arm with D5.5 normal saline with 20 milliequivalents of KCl at 100 milliliters per hour. Ondansetron 4 milligrams was also given for nausea and vomiting. Now, there are some significant factors in her past medical history. Both Jessica's mother and older sister were diagnosed with breast cancer at age 40. Jessica also has a history of depression that is currently being treated with duloxetine 60 milligrams daily. So overall, here's her current assessment. Neurologic, she's alert and oriented ×3. Cardiovascular, the heart rate is regular with no adventitious sounds. Her potassium level in the ER was 3.7, and that level is going to be repeated this morning. The IV site is in the left forearm with D5.5 normal saline with 20 milliequivalents of KCl at 100 milliliters an hour. Respiratory, her lungs are clear to auscultation bilaterally. Gastrointestinal, the abdomen is soft and non-tender with hyperactive bowel sounds noted in all 4 quadrants. She hasn't vomited for 3 hours, and her last dose of ondansetron was at 4:30 a.m. Genitourinary, she is voiding dark amber urine without difficulty, and we're measuring her intake and output.
Okay.
Integumentary, she has +1 edema in the right arm. The incision area from the right mastectomy is healed with no open areas. And no ulcerations were noted in her mouth, and the rest of her skin is clean, dry, and intact.
Do you have any recommendations for Mrs. Stone?
A few. Her lab work was drawn at 6:30 this morning, and the results aren't back yet. But when they do come in, just pay particular attention to her white blood cell count, looking for neutropenia or infection. Also, check the potassium levels to see whether we need to continue giving potassium in the IV fluids. And of course, all blood pressures and blood draws must be done on the left arm. And I'd keep assessing for stomatitis, even though it typically doesn't occur for 5 days after chemotherapy, but her mouth might be more sensitive from the vomiting.
Okay.
Do you have any other questions?
No, I think I've got it.
Okay, good. Well, my shift is over, so I'm going home, but
Okay.
looks like she's in good hands, so
Thanks.
have a good day.
Thanks, you too.
You're about to watch a registered nurse conduct a focused assessment of a patient with cancer who's experiencing complications from chemotherapy. Note how she performs each step, and just as important, how she explains what she's doing to help the patient understand what's being done and why.
Good morning, Mrs. Stone. I'm Ann Cooper. I'm going to be your nurse this morning. How are you feeling today?
I'm feeling all right. It's just these past couple of months have been really rough. It's just really hard.
You know, you sound really upset.
It's just that I feel so alone sometimes.
That's not an uncommon feeling. Do you have anyone to talk to about how you're feeling?
I've been talking to my sister, and she had breast cancer too. But you know, sometimes I just feel like such a burden to her.
So, would you say you feel like you'd like someone else to talk to who's been through what you're going through?
Yeah, I think so.
Well, the hospital does offer a support group for cancer patients. It can be very helpful to talk to someone who's been through what you're going through. I can get you some information on it.
Yeah, that would be nice.
I'll be sure to bring you the pamphlet.
Thank you.
I just need to wash my hands and then I need to do some assessments, okay?
Sure.
Let's check your ID band. Can you tell me your full name and date of birth?
Jessica Stone, May 8th, 1974.
Great. And do you have any allergies?
No.
Okay, good. So now we'll start with your vital signs. I'm gonna get your temperature first. .4. Good. No fever. Next, I'm going to get your blood pressure. It's important that all blood pressures and blood draws are done on the left side. By avoiding the right side where you had your operation, we help reduce the swelling that way. That's why your IV is in that side too.
I remember them telling me the same thing when I had my surgery.
Okay. I'm just going to put this blood pressure cuff on. It's going to squeeze a little bit. Okay, you can relax. Good. (100/60). And now I'm just going to measure your heart rate. Just need your wrist here. Your heart rate is 84 and your respirations are 20. And the last of your vitals is your oxygen saturation.
What is that thing used for?
Oh, this is a pulse oximeter. It measures how much oxygen is being carried on the blood to your tissues.
Oh.
I'm just going to place this on your finger.
I saw them use that at my surgery, but I didn't know what it was for. The good thing is it doesn't hurt.
That is good. And that's it for your vital signs. Now I'll need to listen to your heart and lungs.
When performing a cardiac assessment, listen to the 5 areas of the heart, checking for any abnormal heart sounds. Patients experiencing dehydration and undergoing electrolyte replacement are at an increased risk for an arrhythmia. Listen closely for any irregular heart rhythm or extra heartbeats. Document the heart rate, rhythm, and notify the doctor about any abnormal heart sounds.
You've been getting a lot of IV fluid, so we just want to make sure that your heart is handling the workload and that your lungs remain clear. To do that, I'll have to listen from up under your gown.
Okay.
Let me just shut the door first for some privacy.
Thank you.
I'm going to listen to your heart first. You can just breathe normally. Okay, sounds good so far. Now can you turn to the left side for me? I need to listen to what's called the PMI, the point of maximum impulse. It just makes it easier to hear it from your side. I'm going to place my stethoscope under your gown again. Okay, good. You can turn back. There's no unusual sounds there either. And now I need to listen to your lungs. First from the front and then from the back. I'm gonna go under your gown again.
Okay.
Can you take deep breaths through your mouth for me? And again. Okay, I'm gonna go to this side of your gown. Good. Now, if you can lean forward for me, I need to listen from the back. I just need you to take more deep breaths through your mouth.
Okay.
And again. And last one. Great. You can lean back. Your lungs sound all clear. I'm going to be checking them frequently throughout the day also.
Okay.
When conducting a gastrointestinal or GI assessment of a patient experiencing complications from chemotherapy, first ask the patient about any nausea or vomiting she may have had. Then, assess the abdomen by listening to all 4 quadrants and palpating the stomach for rigidity, firmness, and tenderness.
So, Mrs. Stone, are you currently experiencing any nausea or vomiting?
To be honest, I am feeling slightly nauseated. But the good thing is I haven't thrown up in about 3 hours. I was getting sick a lot more often before I came in. You know, I think that medicine they gave me in the middle of the night really helped.
Do you feel like you need any more medication right now?
No, not right now.
Well, if you are experiencing any nausea or vomiting, if it gets worse, just let me know and we'll give you medication right away.
Thanks. I'm feeling better now. But is this going to happen with every round of chemotherapy?
Well, it's not uncommon to have nausea and vomiting right after chemotherapy. Your doctor will probably change the antiemetics you receive prior to the chemotherapy at your next treatment. This will hopefully prevent nausea and vomiting from returning.
No, that's good to know.
Yeah.
Thanks.
So now I need to check your stomach. I just need to lift your gown.
Yeah, that's fine.
First, I'm just going to listen. Good.
What did you hear?
Some gurgling sounds.
Is that unusual? I'm just wondering because I was vomiting so much before I came in.
No, it's not unusual at all. It's exactly what I wanted to hear. I'm just going to touch. Does it hurt when I do that?
No.
Okay. I'm just palpating for pain or tenderness. Good. So you have bowel sounds in all 4 quadrants of your stomach, and your abdomen is soft and non-tender. So that's a great thing. And now I need to just assess your IV. Can I take a look?
When assessing the IV site, check for redness, edema, or drainage. Any of these findings is an indication that the IV site should be changed.
Does it hurt there?
No, it's okay.
Good. And you don't have any redness or swelling, which is exactly how it should be. I'm just going to check your IV bag and the rate.
Also, assess the IV bag and rate to ensure it matches the current orders.
You have D5.5 normal saline with 20 milliequivalents of potassium at 100 milliliters per hour. That's correct. Well, everything seems to be in order, but you let me know if you have any pain or swelling with your IV, and I'll change it right away. Okay. So tell me, do you have any burning inside your mouth or around your lips?
No, nothing like that.
Okay. You mind if I take a look inside your mouth to check for white patches or ulcerations?
No.
Okay, good. I'm just going to use this pen light. Can you say ah for me? Good, nothing there. Since you've started the chemotherapy, you may have some burning inside your mouth or around your lips. Some ways we can help reduce that is to have you brush your teeth after each meal with a soft toothbrush. Another thing you can do is to avoid using mouthwashes with alcohol. The alcohol inside the mouthwash will dry the tissues in your mouth and further increase the irritation.
Really? I didn't know that. I'll definitely do both of those things.
Good. Now the next thing I want to do is check for swelling by comparing your right arm to your left arm. Can I just take a look at your fingers? You can put that. Okay. The right side does definitely look more swollen than the left. I'll just have to elevate it on a pillow.
They had me elevated a lot after the mastectomy. I was really good about it while I was resting, but then once I got sick, well, I have to admit I haven't been as good about it.
Well, that's okay. Don't worry about it now. We'll just elevate it and keep an eye on it. Okay, let me get you a pillow. And how's that feel?
That feels good.
Great.
After mastectomy, patients are at risk to develop lymphedema, or swelling of the arm. This is a transient edema that occurs in the arm on the operative side until collateral circulation takes over. This is treated by encouraging the patient to elevate the arm and complete prescribed exercises.
Okay, Mrs. Stone, I believe I'm finished with your assessments for now. I'm going to check your lab work to see if everything is back from earlier this morning. Specifically, I'll be looking for your potassium level and your white blood cell count. If your potassium level is normal and you can hold down some fluids, we may be able to discontinue the IV fluids later in the day.
So no more being hooked up to this thing? That would be good.
That would be. And we'll be monitoring your white blood cell count every day to check for signs of infection or to see if the chemotherapy has compromised your immunity in any way.
Is that a risk?
Yes, it is a risk, but there are some things you can do to help reduce that risk. While you're receiving chemotherapy, you're going to want to avoid contact with anybody who is sick with an infectious disease, such as the cold or flu. You should also practice good personal hygiene. This includes washing your hands after using the toilet and before eating. And make sure you get plenty of rest. You may also find yourself getting tired, and that's a side effect of the chemotherapy. I'm sure you're a busy person, so this is something you may not be used to, but it's important to rest frequently. So we'll plan your daily care activities around your energy level. And if you feel the need to rest, please let me know so I can shut your door. I'll be back later on, and please let me know if you need anything at all. Do you have any questions?
No.
Okay. Just want to make sure you have your call bell. Okay.
Thank you.
You're welcome.
You will return all of the equipment and promote good infection control practice by washing your hands. When compiling your report, keep in mind that by noting trends from one assessment to the next, you can provide helpful insights for the patient's care. Based on your assessment, nursing diagnoses for Mrs. Stone may include risk for infection related to altered immunologic response, risk for impaired skin integrity, imbalanced nutrition related to nausea and vomiting, fatigue, disturbed body image, and situational low self-esteem related to changes in appearance, function, and roles. Thanks for watching this video on performing a nursing assessment of the patient who is experiencing complications from chemotherapy. Be sure to also study the instructions in your textbook, and please review this presentation at any time to support your learning and patient care.